I thought I would focus on, just to talk about something different actually, was some of the sources of support and guidance you can go to outside of meetings like this to help you as you work through the issues around health and care integration. And the first source of support is work done by, I said Skills for Care is one organisation, but ADAS and others produced a very good document about the principles of workforce integration. There's also a second piece of work undertaken by the Centre for Workforce Intelligence. Their document was called Think Integration, Think Workforce, and if any of you want to come to me afterwards, I can give you more details of those documents. But they've done quite a lot of research drawing upon different examples of integration about the key issues that emerged and what's described here as the key principles. I don't want to mention them all because I think that others have done that in presentations today and will do so to come. I think one of the things I would like to mention and say, though, is what is the workforce that we're talking about. We talked a lot this morning about the workforces in health, the workforce who work in local authorities, but clearly one of the key workforces we need to think about are those providing care, often in private organisations, and also carers themselves. So in thinking about workforce issues, it's very important to think in the broadest sense about what the workforce is. I think the other thing to think about is about that overcome resistance to change. I think there was a very good question earlier about, when it comes to crunch, workforce, they may have been quite positive, talk well, but when it comes to the impact upon them, there's some nervousness and so forth. I mean, I don't have any fantastic solutions to that, but just to recognise, that change curve that as HR professionals we knew when we were younger, perhaps, is still very relevant. It's very important to bear that in mind as you work through the process of change. And of course, engagement is the key thing. Engaging the workforce through that process of change, making them sure they feel part of the change process, able to influence it, as well as being impacted upon it. I think that process matters. I think that in terms of managing that change, I think it came up in another question about what can we do to ensure change goes well. In any change process, I'm a great believer in symbolic change. Demonstration that change is happening, that it's meaningful, that it's not scary. People talked about teams coming together. It's very important that the leaders of the change process demonstrate the kinds of behaviours that they want to see their staff fulfilling at the end of the day. And that's very much a theme in the next kind of source of advice and guidance that I'd like to share with you. The work that Audit Scotland have done at looking at the experiences of health and care integration in Scotland. And they have had community planning partnerships back from 2010. Yes, they're now introducing legislation around pushing care and health closer together, but they've had voluntary partnerships for a long time. A lot of experience from which to draw. And the audit report is quite telling, worth looking at. I think one of the key things I wanted to pull out in this slide is it does come back a lot to leadership, I think. Without clear, consistent leadership, then it's very difficult to be successful in taking forward integration and very difficult to achieve good workforce integration. And I think that idea of having a very clear and shared vision, the strategic plan we just heard about in Manchester is a great example of that. I think being very clear about decision-making processes. When the crunch comes, how are decisions going to be taken and where you can't agree? What are going to be the mechanisms for resolving differences? And also, understanding what are the mechanisms going to be for scrutinising performance and holding partners to account. As has been said already, the kind of regulatory arrangements don't really fit with this kind of joint working. So what are going to be the arrangements for holding people to account? And I guess, coming back to this issue of leadership and partnership, we've been talking about this for an awful long time. I've been in Barking Dagenham for 5 years. We've been talking about it for 5 years. We've had lots of meetings, and I'm sure it's the same on the health side, but our local authority people come back scratching their heads, quite frustrated about the ability to make progress. Now is the time when we really do have to make progress. Perhaps the financial cliff we're all facing will force us, but it will still be about leadership, and leadership that can really move this agenda forward quickly because there isn't an awful lot of time. And I think, The other key messages from the Scotland audit in Scotland are, that workforce planning is key, but they haven't seen a lot of progress on it. So it is really something that needs to move forward very quickly, because everybody says developing that skilled workforce with different skills, the ability to work in that integrated system, is crucial to success. Now, I wanted to focus a bit more, time I've got left, on this work around the 21st century public service, work that's been led by the University of Birmingham. And why I think it's important is that, health and care integration is only one part of a bigger picture. And it was mentioned in terms of the Manchester devolution, but for all of us working in health and local authorities, looking at the way we provide services differently in the future is very much at the heart of how we're going to be. Local authorities, because of the impact of the funding cuts, have got to become very different vehicles, delivering less, empowering the community more. And this piece of work is very much looking at what does this mean in the broadest sense for public servants going forward. And I've got a few slides to unpick a few of what I think are the most important elements, but some of the ones that I'm not going to cover in those slides are listed here. We talked about skills earlier, and that idea that we train people in their professional skills. What about that broader skills that are going to make partnership a success in the future? So the kind of skills the public servant work are looking at are those around really effective communication, about being very caring, that ability to work in partnership. And there's a great emphasis, and I'm not sure it's so much about training, about behaviours, about everybody being human in their interactions with each other and in their interactions with the people that they're serving. And certainly there's a training element, but it also impacts very much upon recruitment going forward, and our recruiting people for the values they have as much as the skills that they have. I think there was a mention earlier about that need for greater commerciality in the way that we go about our business and the skills that we have, but that being linked and integrated with that sense of public service is very important. Fluid organisations no longer working in silos, and very much rooted in the locality, people having that real sense of being part of a place and contributing to a place rather than being part of a profession. And the final one, very much learning from others and expecting to continually improve. I think one of the things that we've got to get across to our people in the future is that there are no longer change processes, if there ever were perhaps, that have a fixed start point and end point. We're now in a period of real change, and continuous improvement is something that we need to get used to and be able to work within. So I wanted to pick out one or two of the points more. This idea we're in that new public service age, one of what is called, I'm not sure I like the term particularly, but perma-austerity. There's no sense that austerity is going to have to come to an end. It is, at the moment, both inhibiting change in people, making people feel cautious and anxious about the future, but it really is catalysing change. And one of the really good things within my organisation is our chief executive doesn't talk about the savings we have to make, the 30% savings. He talks about how we're going to spend the money we have left, a much more positive way to present the situation that we face. It is all about new relationships with our citizens who are much more savvy, much more access to technology, understand the issues that they face, will no longer allow themselves to be led by professionals, but expect to co-create the services they get with the people they work with. And I think that's very much going to be about building new skills that enables people to work effectively with people in a different way, to work with them to create the care that they need. And it's also very much a different style of leadership. I think I talked about leadership and that need to create a sense of urgency and make things happen as leaders, but it also is about a different style of leadership, very much about empowering people, that idea of distributed and collaborative leadership mentioned earlier, that idea of being able to manage upwards. And one of the key things that I think we need as HR professionals to help our leadership with, both our most senior leaders but down the organisation, is equipping them to lead in a very different way, about leading in partnership, but about truly empowering our staff if we're going to be able to work effectively with the citizens to really make the most of the money we're going to have in this era of perma-austerity. And it is coming back finally to that point about new roles and new skills. Within the 21st century public servant work, they talk about things like being a municipal entrepreneur, a networker, a navigator through the system, a systems architect, a storyteller, a commissioner, having commissioning skills, a broker. But I think at the core of it is very much about that sense of working effectively with others to make the system more effective and think through the kind of issues and skills that our staff need. And if you need some source of guidance and advice and stimulate your thinking about the skills that are going to be needed going forward, I'd very much recommend this work around the 21st public servant. It may not have the terminology that fits well with your organisation, but it certainly is a rich source of information about what you need to be thinking about. Thank you.